character of the movie, American Sniper, is based on the actual Chris Kyle. Chris Kyle is a Navy SEAL sniper that spends many tours in the Middle East fighting in some of the most intense combat imaginable. Chris Kyle seems to have post-traumatic stress disorder. PTSD is a term used to describe persistent, negative emotional, physical, and cognitive symptoms that can occur after an extremely horrifying experience. PTSD occurs after a life-threatening or catastrophic event, such as war in Chris Kyle's scenario, that leaves symptoms such as intrusive thoughts or flashbacks about the event, avoidance of similar events, and self-blaming. Other symptoms include short tempers, recklessness, and self-destructive tendencies. The DSM-V puts this disorder in trauma and stressor-related category. Throughout the movie, we see many examples of Chris Kyle's constant struggle with PTSD. A very strong example of the symptoms of PTSD that Chris Kyle is facing is when a tiny incident causes him to lose his temper very quickly, showing his very short temper. He is relaxing at his kid's crowded birthday party when the family dog begins to play slightly rougher with the kids. Chris springs into action, tackles the dog, and looks as if he might beat the innocent dog with his belt, until his wife yells, snapping him out of it. Another very strong example of a symptom of PTSD is when Chris experiences flashbacks of the horrifying experience that caused his disorder. He is sitting in a chair staring at a blank TV screen, hearing sounds and cries of war while his kids play around him. He is unable to block it out, and it comes very frequently. Chris Kyle seems to display almost all of the symptoms of PTSD throughout the movie, but one missing symptom might be avoidance of situations that might trigger recollection of the event. Chris does not seem to avoid many situations that are similar to his time overseas, and even starts a program to take other PTSD patients to shoot at the gun range. This also helps him. Chris Kyle should be prescribed some medication to ease his depression, anxiety, and other symptoms, but therapy sessions would work the best in treating the underlying condition, which he does attend some therapy sessions throughout the movie. The long-term outcome of this treatment could be that the medicine will initially help with the symptoms, and then after many therapy sessions, he will be able to overcome the PTSD without medication. This treatment method concentrated on therapy is appropriate because the disorder is mostly a psychological disorder. One ethical concern for this treatment, however, is that the medicine used to treat the symptoms at first can lead to a very absent personality within the person. The movie American Sniper sets out to capture the complications of PTSD after war or other serious catastrophic events, and it does a very good job of it. The movie displays almost all of the symptoms of PTSD, and it is very easy to tell what he is suffering from. Bringing PTSD and other disorders into popular movies makes the disorders less odd and educates people in accepting others that may suffer from various disorders.